Hello, everyone. Today we're going to be discussing Brownville Hospital health literacy training. It's going to be a short workshop, but it's going to be packed full of information. And it's basically about the limited health literacy, and we're going to give you a definition of health literacy, discuss the population that you serve here at Brownville Hospital, some different campaigns, public health campaigns, as well as some recommendations for how to improve health literacy and the discussion and conversations that you have with patients pertaining to their health. So I'll start by giving you a brief definition of what health literacy is. For the purposes of this training, we're going to use a working definition of health literacy from the Institute of Medicine. Health literacy is the degree to which individuals can obtain, process, and understand the basic health information and services they need to make appropriate health decisions. Health literacy is important because it may affect the health of Americans and the ability of the healthcare system to provide effective, high quality health care. So next, we're going to discuss the population that we serve here at Brownville Hospital, which I'm sure you're probably all aware of, but we're just going to review it in case we have anyone that's new or not familiar with the information in the population. Brownville is a 500-bed hospital situated in a large metropolitan area with more than 750,000 residents. Many of the residents are minorities because they are either Black, Asian, or Hispanic. 35% of the residents are foreign born and speak a language other than English at home. And additionally, the median household income is $35,000 per year, and more than 30% of residents did not graduate from high school. So basically, to sum all of this up, this is telling us that we'll have to be culturally sensitive when providing information about healthcare and treatment. And not only culturally sensitive, we'll also have to be sensitive to the fact that we're serving people that English is their second language, as well as people be educationally sensitive because several people did not graduate. You have several individuals that did not graduate high school, so they're going to have a lower literacy overall in general. So next, we're going to go over the two key areas of concern for this workshop. And the two key areas of concern are communicate clearly with patients and address language and cultural differences. Under communicating clearly with patients, I have two pictures. One picture is an example of clear communication where the patient is understanding what the doctor is saying. The second illustration that I have here is the patient. He looks like he has a blank stare, like he really doesn't understand what the doctor is telling him. And the third illustration is of people from a different cultural background, of how it's easy to be lost, confused, unsure, unclear, or perplexed by what the doctor is telling you, even if you've been in the United States for a while, but however, English is your second language. So, why is it important to health literacy? Why are these two key areas of concern important to health literacy? Communicating clearly with patients in the field of health literacy is important because it helps the provider to build a rapport with patients. And that's so very important because the first thing you have to do with your patients is build a rapport in order to gain their trust. Additionally, there is also a link between limited health literacy and poor health, which is contributed to poor communication quality within healthcare delivery organizations. And secondly, it's important addressing language and cultural differences is important to health literacy because low health literacy, cultural barriers, and limited English proficiency have been coined as a triple threat to effective health communication by the Joint Commission. The next thing that we're going to discuss is some health literacy campaigns and programs that are in place now to improve health literacy across the board. One interesting campaign that or an approach that I came across was the Universal Precautions Approach, which is a national health literacy campaign that supports the National Health Action Plan and addresses social determinants of health. The approach means treating all patients as if they are at risk of not understanding health information, much like doctors and providers treat all patients as if they themselves are at risk of contracting something from them, contracting a disease or illness or something like that from them if they don't use gloves or hand sanitizer or wash their hands in between patients. So when the healthcare providers use this approach, they acknowledge that professionals can't accurately identify who understands and who doesn't understand. That's basically like you can't walk in a store and tell who will understand health information that's disseminated to them and who does not. You can't tell just by the way someone looks. The campaign supports public health as well as the following social determinants: health, functioning, quality of life outcomes, and health outcomes, because theoretically, the patient will be more compliant in following their treatment plan if they understand their condition and what is being asked of them. The campaign also supports public health by disseminating simple, clear health educational communication and materials that positively impact health outcomes. So they disseminate material that's on at least like a sixth grade level so people can understand. It's like plain language. People really understand what the education is being provided. And down here at the bottom, I have a little illustration of universal design. It says universal design is a process of creating products, environments, and systems which are usable by people with the widest possible range of abilities. And you can see there's a vast amount of people down there that's very different in many different ways: age, cultural background, their abilities or disabilities that set them apart. Some of the recommended best practices that we will be discussing is the readability test tool. Basically, you can use this tool to assess the level of real-world patient information, like brochures or websites. You can test the level, the complexity level of those resources. Plain language was another recommended best practice. Using plain language while discussing a patient's diagnosis, medication changes, and treatment plan to remove the barrier of confusion. Another recommended best practice was providers should also use the simple teach back technique, such as educating patients on diagnosis, then asking simple questions on what the patient would do in different scenarios. For an example, you could ask a person that's diagnosed with diabetes how they would take care of their feet, or what would they do if they had high glucose level readings. And lastly, another recommended best practice would be the use of the language access services to improve health communication across cultures, language, and literacy. It's important for providers to be prepared for their patients when they come in. If the provider is aware that they have a Spanish speaking patient coming in, they can access the language access line and have someone available to speak to that patient or to translate for that patient, because oftentimes patients bring in family members that are not trained or equipped to have those discussions with the provider on the patient's behalf. So next we have a group exercise that we're going to go over. If you have, and I want to give a minute or so to see if anyone had any questions. If you don't have any questions, that's fine, because I'm going to send these slides out, and we're going to also have a follow-up workshop, a couple follow-up workshops to this workshop. So the summary of the exercise, basically each group, we're going to be doing a role play. It's going to be a group of 3, and one person is going to act as a staff member, one person act as the patient, and one person act as the observer. And the staff member's job is to educate the patient. The patient's role is to interact with the staff based on the assigned level of health literacy, and the observer's role is to observe and assess any signs of miscommunication, whether that be body language or language from the patient or the provider. The purpose of this exercise is to allow participants to demonstrate clear health communication principles, because this is something that you will be using in a day-to-day setting when you go back on the floor. It is going to give you signs and show you examples of how people react when they have low health literacy, when they don't understand, or when there is a barrier to communication. The 2 key areas of concern that this exercise will address is communicating clearly with patients, because it helps build a rapport, and addressing language and cultural differences, because low health literacy, cultural barriers, and limited English proficiency impact health outcomes for patients with language barriers and cultural differences. So those are the 2 areas of concern that this exercise will be addressing. The materials needed for the exercise are as follows. All of these materials are on the front desk. So when you group up, you can come up and get your materials that you need. The steps for the exercise is going to be, you're going to have 7 minutes to discuss the scenario, 7 minutes to write down a couple reasons, just a couple, why communicating clearly and addressing language and cultural differences is important. As you're going to have a couple minutes to assign your roles, 7 minutes to do the role play, and then we're going to break, and the class is going to discuss it. And these are the references that I pulled majority of the information from outside of the exercise. And like, again, I said, this information would be coming out to you. So you don't have to worry about reading it or writing down anything really quick, because you'll have it in your email after this workshop is concluded. Thank you.